Imagine waking up and realizing that you don't know when you're going to be able to eat next or how you're going to be able to afford it. Now, for 44 million Americans, this isn't just a bad dream, this is reality. Food insecurity is the lack of consistent access to enough nutritional food in order to live a healthy life. And this affects far more people than we think. And while people think that it's just a personal issue or an economic issue, it's also a public health crisis. So my name is Adrian, and today I'm going to explain what food insecurity is and why it matters to everyone. I'll be going over the definition of food insecurity and the causes. Then we'll talk about physical and mental health problems that are caused in children and adults. And then finally, we'll look at how the crisis affects the healthcare system and some solutions. So, food insecurity, according to the United States Department of Agriculture, it's defined as a lack of consistent access to enough food for an active, healthy lifestyle. So, according to the USDA report in 2021, along with some research done by Coleman, Judson et al., they found that about 13.5 million households in the U.S. experience food insecurity at some point in a given year. And food insecurity doesn't mean just not eating at all. Sometimes it can mean skipping a meal. Sometimes it can mean going a long time and stretching a meal out that's unprocessed and unhealthy. Or it can just mean choosing medication or a car payment over food. One major cause of this is poverty. So that's not the only thing, though. There are food deserts that were kind of made in these systems and these cities. Food deserts are urban areas where there's no access to healthy food. So there's just liquor stores, there's gas stations, and there's fast food places. So that's another issue where affordable unhealthy food is there, and we can't find any nutritious food of value. Walker and colleagues found that food deserts are mostly in low-income communities, and that these communities are usually of people of color and indigenous communities. So, our second point, health impacts. Kids who suffer from food insecurity are linked to having developmental delays, behavioral issues, and they do worse in school. Adults suffer from obesity, heart disease, and diabetes. And again, these issues are coming from the processed, unhealthy foods that are found, that are cheaper, that are easily accessible in fast food and in grocery stores where it's really, really cheap. Additionally, Seifert et al. Did a study, and they found that mental health is also associated with and deeply affected by food insecurity. They found that people are more likely to be stressed out, to be anxious, and to be depressed when they can only afford cheap foods and are food insecure. All right, now our third point is the impact on the healthcare system and some solutions. So a study in 2018 was done by Berkowitz and colleagues, and they found that about $53 billion are associated with food insecurity, and folks who are food insecure and need to go to the hospital, need to stay into the hospital. And that is a lot of money to be spent. That can be avoided. So, some solutions that are out there, programs like SNAP, Supplemental Nutrition Assistance Program, and WIC, Women, Infants, and Children Program. These programs are for low-income people or individuals who are having trouble finding a job or something, and they can pay with government assistance to get food. So, expanding those programs. Another thing is looking at community-based solutions, so mobile markets, food banks, things like, farmers markets where people can get vouchers. I know that's done here in California, and that's definitely a good solution to have and to be spread across the U.S. to help with food insecurity. And then finally, just providing education and being able to give folks ways to eat healthy, even if it's not really in their budget. They can, to give ways to show that things can be a little bit healthier. So in conclusion, food insecurity is more than a lack of food. It's a public health emergency and crisis, and it affects millions of people in the US and globally. But it is a problem that we can solve. So with policy, with programs, and with the solutions that we talked about today, things can change. So food is not a luxury, and it's a human right, and people should have access to it. Thank you for your time.